Okay, so for the next session, I'm going to take you through how to do a fine needle aspiration biopsy. I think core needle biopsy has really taken over from fine needle biopsy as being the gold standard, but there are still places where I think a fine needle biopsy is very important. Obviously, for a lot of head and neck masses, fine needle biopsy might still be at least your first port of call. It allows us to accurately diagnose a lot of infectious diseases that can give you lymphadenopathy. It also is much readily available. You don't need expensive equipment, and it can be done by any practitioner. It is not a very skilled procedure, and if it's done properly, one can actually get a very, very good diagnostic yield from a fine needle biopsy. So I don't think we should bin this procedure. I don't think we should throw it away. I think it should still be in a lot of places. It is going to be your first port of call because it does have a lot of diagnostic value. So I think a properly done fine needle aspiration is still very useful. So I'm going to take you through what you need to do a fine needle biopsy. First of all, you're going to need some microscope slides. The best ones are the ones with a frosted section where you can write the patient details on, which makes it easier for slides not to get mixed up in the lab. A good quality specimen carrier so that your slides don't break on their way to the lab is quite important. A pencil to write on your slides with. It sounds mundane, but I mean that is something that is quite essential. You need to be able to write the information on the slides. Whether to use a local anesthetic when you're doing fine needle aspiration biopsies is controversial. Certainly some people believe that injecting local anesthetic is as painful as actually doing the fine needle aspiration biopsy. And in very small lumps, it can obscure the lump. So once you've injected a certain amount of lignocaine, local anesthetic around that specimen, you're going to struggle to feel that lesion, and it's going to make your biopsy quite difficult. So I think it's a personal thing whether you want to use the local anesthetic or not. I sometimes do, I must say, and sometimes I don't. It depends, again, on the clinical scenario. One needs a good syringe. I would suggest a 10 ml syringe. One needs to use a needle that you're going to do your biopsy with. This is a black needle, a 22 gauge needle, which is the preferred needle to use. One can also use slightly smaller needles. The blue needle can also work. And the theory is that it's going to be a little bit less painful than a black needle, which is a bigger needle. I think the difference between the two is minimal, and you probably will get a better specimen with a black needle, and that is my preferred needle to use. You need some needles to draw up your local anesthetic if you're going to use them. What we use is an ordinary, readily available dressing tray with everything inside that you're going to need for this biopsy. Some of these dressing trays come with gloves inside of them. This one doesn't have gloves, so I've got some sterile gloves that we use when we do the biopsies. Inside this tray is some swabs. And it's an area where you can put your cleaning solution to clean the skin of the patient. You need some cytofix, something that you're going to fix your slides with so that the staining can be done. You need something to apply a dressing, and then obviously you need a sharps container to get rid of all your dangerous sharps.